Americans with health insurance increased their spending on health care last year as prices for all kinds of health services increased. A review of 6 billion private health insurance claims finds we spent an average of just over $4,500 per person. That's up 4.6% from the year before, marking the fastest growth rate in 3 years. David Newman knows these numbers well. He's the executive director of the Healthcare Cost Institute. That's the source of the study. He joins us from our bureau in Washington. So, David, it was higher prices, not necessarily that we were actually using more healthcare services that drove that increase. Is that right?
That is correct.
And so with that in mind, why, if demand hasn't moved, are prices moving higher?
We really don't know why prices are going up, but they are going up rapidly. And when prices go up, total spending goes up.
You found, in fact, that the fastest spending increases were amongst the youngest patients. That seems counterintuitive because usually we're spending more and more on healthcare as we get older and, let's face it, our bodies break down.
Yes, and this is of particular concern because if our expectation is to, over the long run, bend that long run cost curve, if kids are at all ages more expensive, this is going to be very difficult.
And so what kind of speculation might you have about why the faster increase that we're seeing on spending with the youngest patients?
Well, we don't speculate, but we do have some evidence having looked at these claims, and some of the fastest growth is in mental health services and in prescription drugs. And I should just note that even though spending is going up, in some cases, spending is good. If these kids are getting better services or more appropriate care, that would be good to see.
So in other words, more spending younger in life may actually retard future spending growth as these kids get older if they're dealing with certain maladies, right?
That's potentially the case. We do know that kids that are sick early in age continue to be sick throughout their lives.
This is looking at, and we've been talking about spending by the healthcare consumer. What data have you found about spending by health insurance companies? In other words, are their spending increases in line with what consumers are spending more on?
Over the last 2 years, the relative share of spending between both the insurer and the insured has been going up, but their shares have been relatively constant. Insureds are paying about 16.2% of all dollars.
Now, of course, all this happens with the elephant in the room being the Affordable Care Act, the so-called Obamacare. This data comes in as this act continues to take effect as well as take shape. Among the goals is to bend the cost curve, but at least initially it seems like that cost curve now is actually getting steeper.
Well, I think one of the things to keep in mind is that the Affordable Care Act, most of the provisions come into play in 2014.
Good point. Still lots of years to go there. And we do have to note that you're talking to us despite the fact of feeling under the weather yourself. So we'll let you go see the doctor here tonight. From Washington, D.C., David Newman. He's with the Healthcare Cost Institute.